Dr. Colin Zhu is a family medicine physician and culinary school graduate. We discuss recommendations he has for his patients looking to eat healthier and physicians looking to do the same. We discuss the kitchen essentials with regards to utensils and small appliances, his go-to ingredients for simple, fast, healthy, and delicious meals, and we finish by discussing his book, Thrive Medicine.
Welcome to the Physician's Guide to Doctoring, a practical guide for practicing physicians. Dr. Bradley Block interviews experts in and out of medicine to find out everything we should have been learning while we were memorizing Krebs cycle. The ideas expressed on this podcast are those of the interviewer and interviewee and do not represent those of their respective employers. And now, here's Dr. Bradley Block.
Welcome back to the Physician's Guide to Doctoring. On today's episode, we have Dr. Colin Zhu, who is also known as TheChefDoc. So, Dr. Zhu, thank you so much for being on the podcast today.
Hey, thank you, Dr. Block. I really appreciate it.
So, first off, can you tell us a bit about your training, where you went to med school and residency, what your training is in, and include that bit about culinary school?
Definitely. I'm basically a board-certified family physician. I'm also board-certified in lifestyle medicine, and I'll get back to the lifestyle medicine in a bit. But I went to school in West Virginia. I did my osteopathic training there. For those of you who don't know what osteopathic medicine is, it's basically very similar to MD training, prescription of medications. We can do surgeries licensed in all 50 states. We just have extra training with manual manipulation in the school. Other than that, we look at things from a whole person approach. And that was something that I really enjoyed about philosophies because my mother is a Chinese medical doctor, and she practices acupuncture and herbs and things like that out in New York. And so my upbringing was more focused on prevention, wellness, education, just basically connecting with people. And so after I received my education in West Virginia, I taught an extra year in osteopathic training. And so kind of like a teaching assistant. And so I graduated after 5 years, and that produced a gap year. And so what I did was during that gap year, I just said to myself, what am I going to do? A lot of people said, they would travel and, such and such. And I decided that I grew up with two parents who cooked in the kitchen. I was very fortunate. I'm Chinese in background. And so I just also felt that there wasn't enough nutrition in school. I don't know about you, Dr. Block, but for us, it was around like 10 credit hours, and it was mostly focused on biochemistry. I remember reading a recent survey back in 2010, pretty much 27% of all medical students across the board actually required a nutritional course. And so, I felt that there was a paucity in it. And so I decided, what we need to do, because we fight a chronic disease burden. We have an obesity epidemic, and a lot of things are lifestyle related. And so I wanted to learn more about food. And so I enrolled myself in a culinary school that was health supportive and plant-based. And I did that in Manhattan. After which I went to residency, did my family practice training. And then afterwards, I had used my culinary education to enhance my day-to-day. So what that means is I practice mostly on the outpatient side or mostly in clinics. And in addition to one-on-one counseling with patients, talking about diet and lifestyle tips, I also hold workshops and do demonstrations, food demonstrations, and I also speak at different national conferences about food as medicine and or lifestyle medicine as well. And so that's what I've been using the education for.
You mentioned plant-based, and I just wanted to clarify the terminology for myself. Is plant-based the same thing as plant-only?
No, it's not plant-only per se. We're not talking about vegan where, you're not having any type of animal foods or substances or clothing, things like that. Because sometimes, you could have, the definitions can definitely overlap and vary. Plant-based mainly talks about having a majority of plants. And we're talking about, dark green leafy vegetables, nuts, seeds, beans, legumes, whole grains, very, 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 very little processed oils and animal foods, including meats and seafoods and things like that. So that's what it, mainly means. Vegetarian, there's a whole host of different definitions as such. But when we talk about plant-based, we're talking about whole foods in its entirety and retaining as much what Mother Nature has intended us for.
Okay, good. I wasn't clear on that term, but that certainly clarifies it. So, yeah, it sounds like that's really what a lot of us, dare I say, most of us are recommending to our patients nowadays, right? Mostly plants, little processed food, lean meats. Because if you use a term like vegan, you're right, that also has a lot of other connotations. And I think an excellent example of a vegan food is an Oreo. An Oreo cookie is vegan, so that's not necessarily what we're going for with our patients. But yeah, whole plants and very little processed or minimizing processed foods and processed sugar. So to start, I think it would be great if you could give us some information for our med student or resident colleagues who don't have much time, don't have much income to work with, and may not have so much cooking experience. So if you could help our juniors out there, what are some recommendations that you would have if they maybe come from a house not like yours, where there's not much cooking going on and they don't have much experience? Where should they even begin? Like, what utensils or what equipment should they be purchasing to start with?
Yeah, definitely. It's an excellent question. And like other healthcare providers, including myself and you, we've definitely gone through that phase of our life and knowing what it means to live off of a budget. And I think that it also relates to some of our patients. For me, I do primary care, and we deal with all variety and across the spectrum in terms of social economic classes. I'm currently in LA right now, but before I was in Southern California, and I worked with an underserved Latino community. And before that, I was in Seattle. I was working with refugees in a community health center. And so doing primary care, you get to look at different populations and you kind of meet them where they are. And so, for your med students and residents, this definitely overlaps with also our patient population that are also looking for things on a budget. And we live in a time where, a head of broccoli is more expensive than a liter of Coke. And that is attributed to public policy and, how certain things are subsidized. But that's an entirely different, subject. So I would say where to start would be, number one, looking at your markets, your supermarkets, and also seeing, what is nearby. And to believe it or not, there's actually different kinds and different classes of supermarkets. You have your Whole Foods and, what I would call your upper tier supermarket. And then you would have something closer to the bottom where like a convenience store or a bodega or something like that, depending on what part of the country you're at. And then, you have everything in between. So I would probably say in terms of plants, definitely shop for something local. Okay. If you can visit farmers markets, okay, you not only save in terms of cost, but also you get to meet the farmers and the people that produce and farm your food, right? You actually save in terms of food mileage. And what I mean by food mileage is if you ever look at a produce and you look at the sticker and you look at where it's come, you have to understand and be mindful of how many miles it has traveled until it actually reaches the shelves. And quite honestly, it doesn't get picked and automatically teleports to your supermarket. They need to do a process, bring certain chemicals to preserve the freshness of it by the time it gets to your market, right? So that's one thing to consider. So the closer in terms of food mileage it is to you, the better. Okay. Another thing to think about.
So, but when I was a resident, just the hours that we had to put in, and I'm sure it was the same for you, were so sometimes absurd that getting to something like a farmer's market would have been really challenging. So I really would have been stuck going to just a typical supermarket. So if you have your resident and he's going to the supermarket or she's going to the supermarket, they've never had any type of cooking experience before, and they're just looking for something because you know what? They've been on their feet all day. They haven't been eating anything except for graham crackers and ginger ale. But they want to, do something healthy, but really hard to screw up. So what ingredients are we looking at specifically where it's hard to screw up, so it tastes good, but it's however you want to define healthy, it's better for you.
Okay. So if you don't have an opportunity to go to a farmer's market, I would recommend, if you have the cheapest plant food you can get is actually from ethnic foods or ethnic markets. So, for example, if you have like an Asian market, a Mexican market, an Indian market, you actually save a lot more in terms of produce, and you actually save a lot more in terms of spices and herbs. But to answer your question, if you were to just go to your supermarket, I would definitely say if you have little to no experience in the kitchen, what the supermarket does nowadays is that they actually combine certain ingredients together, so you can immediately put it, in the oven, on the pan, or on the grill. Okay, and we're talking about things like something to start, making fajitas, for example. They would put different tricolored, bell peppers together. You would just pick up whole wheat tortilla from the grain aisle, and then, just make something quick like that. Or, they have things to grill with. They would have portobello mushrooms. They would have different grilling vegetables that you can do. They also have ingredients that they put together, for example, carrots, onions, and celery, that is a base for most soups, a base to make stock with,
Okay, so sorry. So far, a couple of things that you mentioned, just to recap. So sliced bell peppers in a frying pan as a base for, I think you said fajitas. And then what was that base for the soup? Carrots, onions, and celery?
Correct. Carrots, onion, and celery, or it's also called a mirepoix in French. That's a combination for the base of the soup.
Okay. Any other of those simple combinations that we might be able to help those residents or med students out with, so they can make sure that what they're eating isn't just ramen again?
If you do not have time to prepare dry beans from scratch, you can get canned beans or canned lentils, and also quick cooked rice, specifically brown rice. Quinoa is very quick to make as well. And then that could be added with your vegetables. You could stir fry, something really quick, would be a couple more examples as well.
Any go-to batch cooking recipes? So for the listeners that don't know what batch cooking is, basically it's how my family, we live our lives. We cook on the weekends. So my wife also cooks during the week, but sometimes either she or I or both of us will cook together on the weekends, and we will make something that will last for a long time, make a ton of it.
Right.
Have a couple of it, have a little bit of it fresh, and then the rest of it goes into the freezer for use later on, which with a resident or a med student or our patients, right, who are busy and don't have much time for prep, it's a very easy way. You find a window of time, you take advantage of it, you cook a huge amount of it, and then you have a lot to go with. And it's also a cheaper way to do it because economies of scale. So do you have any go-to batch cooking, either meals or recipes?
So this is something that I personally do myself during my busy days in practice. Is I would get most of my grocery shopping and cooking done on a Sunday. And I would, cook for most of my lunches, and then, cook for some of the dinners. To mix it up, I would actually cook every other day if I'm really busy, or maybe cook, fewer or more times, just depending on the week. But I would say the quickest and most nutritious would be to make big pots of soup, stews, or gumbos. Okay. And you could do that with any variety of soup recipes. I would highly recommend a slow cooker. I know that we're going to talk about kitchen utensils, but a slow cooker is a great appliance, also very cost effective, to be able to, put a lot of ingredients into it. And then you set it and forget it. And then it does its own cooking while you can actually cook something else at the same time. So that way, you're not spending time cooking two different recipes. You already have an appliance that's already doing it for you.
Oh yeah, I love the slow cooker. It's not really a plant-based thing, but chuck roast is one of the cheapest cuts of meat out there because there's so much gristle in it and it's so tough. But you throw that in the slow cooker and you cook it for 12 hours on low, and it's just so good. So it's cheap, and then you get just a ton of meat, and then you can mix that in with your soups, your gumbos, it's very, very versatile. So yeah, I love that slow cooker.
Yeah, definitely. I mean, I just made the other night a spicy vegetarian gumbo on using the slow cooker. So I had a separate batch of brown rice on the side, and then I just chop fresh parsley, and you just garnish it, and there you go. That's already 3 or 4 meals.
Oh yeah, and throw the rest in the freezer. So the slow cooker, what other are some essential utensils to have around the kitchen?
So essential utensils is you don't have to have a lot of equipment. You don't have to have an expensive kitchen to cook well. You need to have a few items, and you just need to know how to use them properly. And I would definitely say, spend money on high quality items that is durable. Okay. We don't want to, in my opinion, you don't want to really skimp out on that, because not only does it, affect, the cooking and how well your food tastes at the end, but you also don't want to spend more money replacing the same utensils. So for example, I would recommend getting either a small or large saucepan, okay, where you can make stock and different sauces, or you can also get a frying pan as well. I would say a 8-inch diameter or 12-inch diameter too, if you're making for more than one. I would recommend, stainless steel for these. In terms of a knife, I would recommend a chef or a French knife, as it's called, and a sharpening steel to making sure that your knives are, kept sharp. The only other knife I would recommend that's essential will be a paring knife in terms of fruits and different small cutting as well. Getting a good quality chopping board is, essential. Okay. In terms of other utensils would be a spatula. I probably use a spatula, like a silicone, because it's heat resistant, and you can get that very cheaply. And that is very versatile in terms of mixing, stirring, and things like that. If you want to be fancy, you can get a microplane to zest, different things to put on food. But the only other things in terms of appliances I would get is definitely get a slow cooker, like we mentioned before, a blender. Great things for blending would be making smoothies. Smoothies is a great idea in terms of mixing different ingredients together. That's also nutritionally packed. You can also store as well, and it's very versatile. You can also make sauces out of that. You can also make, a good high quality blender, you can make soups out of that. And also, if you want to be fancy, you can make your own salad dressings out of that. The only other thing I would recommend would be getting a toaster oven. So if you don't have time to bake something, a toaster oven is really quick, depending on the heat efficiency of a toaster oven, very quick to throw a pizza in or any other things you want to, throw in while you're doing something else. Because I know that medical students and residents want to save time.
And I can imagine you can get something like that pretty cheaply. I think we had to get a microwave for one reason or another, and it was just remarkable to me how inexpensive a microwave, like the cheapest microwave they had. I don't remember what it was, but it was something like I was shocked to see how inexpensive a microwave was. So I'm sure a toaster would be relatively inexpensive as well. So how about ingredients? So you mentioned before some simple ingredients that were hard to screw up, but do you have what do you find the ingredients that you're most commonly using? I know for myself, I put chia seeds on anything. Like if you ask my wife, I really put chia seeds on too many things. And when I do, it's inevitably too many chia seeds and therefore I've ruined it. But do you have any things that you tend to incorporate into a lot of your meals?
Yeah. So when I am able to cook, so when you guys do grocery shopping and if the market has a bulk section, and if it does, then that's great because you will save on cost if you get bulk items. And what I would recommend getting bulk items for would be grains like brown rice or quinoa, any variety of beans, black beans, pinto beans, kidney beans, and lentils, green lentils, red lentils. And honestly, those are probably going to be your most nutritious, most satiating, high in fiber, and most cost-effective items to get, right? In terms of produce, what I typically get is always a bunch of kale. Okay, kale is very versatile, and I know that we've been hearing kale and all over the place. And I do a lot with kale. I can stir fry with kale. I can saute kale. I'm a big soup guy, so I always have carrots and onions and celery in my fridge. And then usually I'll just mix it up. I'm a big fan of mushrooms. Mushrooms is very versatile. MSG, which is a very common flavoring, but it's also synthetic and not healthy for us, is actually derived from mushrooms. So when people are saying that, something common I get from patients that, mostly eat meat is that they don't, they think that vegetarian cooking or plant-based cooking is very bland and very, just not flavorful. And if you know what ingredients to use, it's actually the opposite. And mushrooms is actually something that, is actually, very cheap and adds a lot of flavor, to it. Other items I keep on stock would be garlic, fresh garlic, and fresh ginger. Growing up in an Asian household, we use ginger for everything. And garlic is honestly something that is very nutritious and also a great agent to be able to flavor a lot of different things as well. So,
random question. How do you clean a garlic press? Because anytime I've ever used a garlic press, I've never been able to get it clean. There are always tiny little bits of garlic skin and old garlic stuck in it. Any tips? I know this has nothing to do with what we intended to talk about, and this is completely out of left field. But what the hell?
I'll be honest with you, I have no idea what a garlic press is. I actually chop and mince all the garlic myself using fresh garlic. What does it do? Does it clamp down and give you a little? How does it?
Exactly.
It's
got a bunch of holes in it. It's got a bunch of holes in it, and like just like a press. So you get squeezed through these tiny little holes, and then you're stuck with like some garlic remnant on the other side. Hard to peel out. Okay,
Garlic is tricky because if your hands are wet or if the garlic is wet, then the actual peel of it will be stuck to anything, the board or, any of the utensils. So what I do is, I just take a couple of cloves of garlic. I use the flat surface of my knife and I smash it. I remove the peel. And then I just hold the garlic and just basically just chop garlic. And then I just throw that to start any type of recipe or any type of cooking I'm doing that night.
What about snacks? Because a lot of times what I tell my patients is try to have something relatively healthy that's just out all the time. So that if you're walking by, you're more likely to snack on that. And then, which then in turn makes you less likely to snack on something that might not be as healthy for you. So what are your, either for yourself or what you recommend to your patients, what are your go-to snacks to just keep out and keep available?
Well, I think the first thing that you touched upon is, whenever you walk into an office, it's a very common thing to have, candy or chocolates right there. And I feel that if you remove, that item from your site, you're not going to be wanting to try to, reach for it. For me, I'm more of a firm believer of, getting good, nutritious, satiating meals 2 to 3 times a day. That way that prevents snacking in between. I believe that, if you snack, more, that you're just going to be adding extra calories that you may not necessarily need. So But to answer your question, I would, for me personally, in my office right now, I go to a wholesale club like Costco, for example, and I, just get a jar of raw mixed nuts. And we're talking about pistachios, cashews, walnuts, pecans, things like that. It's easy to reach for things that are roasted and salted. And what you don't want is the processed oils and the extra sodium. So, and I know very common things to get would be like potato chips and things like that. But honestly, if I ever need to snack, and I do too, I always reach for a jar of raw mixed nuts. Another thing you can do is, honestly, if you can prepare snacks ahead of time and you know that you're going to be snacking, pack fruit with you, fresh fruit with you, pack, very simple stuff, celery and carrots, and then bring a jar of peanut butter or almond butter or cashew butter with you. The combination of the two would actually satiate you. So it's really about the preparation, and that way you're not going to have hunger pangs and then have the impulses to grab something. That is where, we falter, is when we are not prepared. And then we're like, oh my God, I'm so hungry. And then you get hangry, and then you reach for something that is not nutritious because you're trying to fulfill that, that immediate need.
So it's kind of like dig your well before you're thirsty.
Yeah, exactly.
Whatever before you're hungry. Yeah. So what about for our patients? I think a lot of the stuff, if not all of the stuff that you've mentioned so far, are excellent recommendations for our patients who may be suffering from a metabolic disease. But is there anything else that you haven't mentioned so far that you may be telling to your patients about improving their eating habits, or if they haven't had much experience in the kitchen, or things that you would tell them about ways to prepare foods and certain foods to prepare that you haven't touched on yet?
I think what we touched upon are very similar items that I touched on with them. What I use is a couple of resources, online resources as well, because we live in a world where pretty much everyone is quote unquote connected and virtually connected. And so I rely on that as well for those that are, tech savvy, whether they use a computer or use their smartphone. So metabolic diseases, like chronic diseases like heart disease, high blood pressure, high cholesterol, people, with stroke and things like that. These are different things that we deal with on a day-to-day basis. So what we do is that I actually counsel them and coach them on, pretty much the same thing. And one of the resources that I would love to give you is looking up Dr. McGregor's Daily Dozen. And he is the founder of nutritionfacts.org. And it is a free resource online and on a smart app, commercial free. Everything goes to charity from his website, and all the information there is vetted out, all scientifically based, evidence-based nutritional information. And so he came up with a Daily Dozen that, after so many years of looking at different nutritional scientific journals, he's vetted out different food groups, kind of similar like a food pyramid or food plate, that we have. And so I actually print that out, and I actually, I can email this to you, Dr. Block, later on, but I actually print that out and I give them that as a handout, and I say, hey, are the different food groups that I want you to, look at. And these are including similar stuff that we're talking about: berries, whole grains. We're talking about, cruciferous vegetables like Brussels sprouts, cauliflower, broccoli, flaxseed, fruits, beans, nuts, things like that. It also includes recommendations for exercise. And what I tell patients is 30 minutes at least of moderate intensity exercise that you enjoy. If it's not enjoyable, it's not sustainable. And moderate intensity is basically you're huffing and puffing and huffing and puffing to the point where you cannot maintain a conversation. Okay. That's moderate intensity. Beverages, we recommend at least 60 ounces of water. You can also do green tea, which is also packed with antioxidants, and hibiscus tea, which is proven to actually lower blood pressure as well. So that's what I give to them. A second resource that I would give to my patients is put out by the Physicians Committee for Responsible Medicine, also a nonprofit organization. And they came up with a program called the 21 Vegan Kickstart. Now, what I tell patients is that don't let the word vegan, mislead you. What it is that it's a free online website and an app that you can just type into Google called 21 Day Vegan Kickstart. And what it is that it's a plant-based introduction. So this is also good for your medical students and residents. It helps with grocery shopping. It helps with meal prepping. And they have plant-based recipes all for a 21-day program, all free. So what I do is that I print these two resources for my patients and I give it to them. And I tell them to follow up, in X amount of weeks or months, especially the ones with diabetes. And I tell them, hey, let's go over this. Let's get back to this, because in my opinion, it's not a one-off where you see them for your physical and then you say, hi, goodbye, and I'll see you in a year. For me, things are more reinforced for behavior changes if you see them more frequently.
Wow, we'll definitely link those up in the show notes. So the Dirty Dozen and then the Vegan Introduction, right?
The Daily Dozen, Dr. McGregor's Daily Dozen.
Dr. McGregor's Daily Dozen. Okay, thank you for clarifying.
Yeah, no problem.
So the other thing that we were going to talk about today was your book.
Yes.
And I think you just released an edition now it's out in multiple languages, right? You just released an edition in Spanish.
In Spanish, yeah. So I wrote a book called Thrive Medicine, and it's basically a labor of love. It's kind of part memoir, part, self empowerment type of book. And it highlights my experiences as a traveling physician, or locum tenens is what it stands for in Latin. And what that means is to hold a place. And what that means is that when a physician passes on, goes on vacation, has maternity leave, or for whatever reason can't work in a certain period of time, people like us are hired to be able to fill the spot. And so from this experience, I was able to practice in 4 different states, practicing in varying different patient populations. And so I use my experience from that. And I also travel the world as well. I've touched every continent, and I've visited more than 30 countries so far. And what I've gotten out of that are really, really great connections with different travelers, different people from all walks of life. And what I really, really enjoy is the deep connections with people, even if it's just for a few moments or for a few months or years. And what I've noticed and observed is that people give me a lot of feedback about how Colin or Dr. Zhu, you've definitely inspired me to do X, Y, and Z. And so over time, I just thought to myself, wow, wouldn't it be great if I could just put all these experiences onto paper? And that's what I did. It took me 1.5 years to publish the book in English. And now I just released it in Spanish. And it's also available in audiobook format, as well as Kindle.
Wow. Really, really getting it out there. Was it you that read the audiobook version?
Yes, I narrated the book myself.
Wow. So since the book is Thrive, can you give us one simple habit for our physician listeners that we can do that can help us thrive and live more fulfilling lives? Something simple and easy to execute.
Yeah. So I definitely say in our current world where in our healthcare state, and, we work hard as physicians, from all specialties, physician burnout is something that we hear about in the media, a lot. And I definitely want to emphasize self-care. Self-care is basically what it means, literally. And that's taking a moment, taking a day, taking a few hours to reflect, reset, okay, and reinvigorate yourself. And basically remembering why, you do the things you do, whether it's personally or professionally. And personally, I am a firm believer that I don't want to preach something that I don't do myself. And so I believe that every doctor is a role model and a community leader, and we need to be able to walk our talk. So all the different dietary and lifestyle changes, that I emphasize, I do myself. And so self-care is definitely something that I would want, more of my physician colleagues and friends to do more of. And, and that in turn leads to a more fulfilling functioning and daily life. And I just feel that, the better you take care of yourself, I honestly think the better you take care of your patients. Because if you go down, then, who's going to take care of your patients? So, that would be the biggest thing that I would emphasize towards our physician listeners.
Well, if people want to get the book and learn more about you, where can they find you online?
They can find me online at my website at www.chefdoczoo.com. I have Facebook and Instagram that I'm mostly active on, and also YouTube. And you just type in the Chef Doc, without spaces, CHECHEFDOC into those social media outlets. And then you can also find my book on Amazon.
Great. This has been extremely informative for me. I'm anxious to now get back in the kitchen, and I hope our listeners feel the same. I'm sure they do. So thank you very much for taking the time to talk to us from the West Coast. It's been a pleasure.
Thank you so much. I'm excited. Awesome.
That was Dr. Bradley Block at the Physician's Guide to Doctoring. He can be found at physiciansguidetodoctoring.com or wherever you get your podcasts. If you have a question for a previous guest or have an idea for a future episode, send a comment on the webpage. Also, please be sure to leave a 5-star review on your preferred podcast platform. We'll see you next time on The Physician's Guide to Doctoring.